USC and has been for hundreds of years. And I'm sure she will. And she's a world expert, world-renowned, particularly the vascular and metabolic damages that contribute towards dementia. And she's chair of the Department of Neurology. This is one of the most chauvinistic medical departments in the country, in the specialty of medicine, in the field of medicine. And so our illustrious female chair of department is just there because she's so good. And we have a great collaboration with her and her colleagues at USC, and I don't really want to say any more. You'll be thrilled. If you haven't heard her speak about this, you'll learn a lot. So Helena, it's your turn.
100 years old. Well, must be a goddess. Because I only look 65 or 75. Well, the truth is I'm in that window to sign up for Medicare. Do you know there's a 6-month window between the time you turn 65? You heard about that this morning. So you don't want to miss that because Medicare has wonderful benefits. I live in Pasadena, above the Rose Bowl, and at least once or twice a month, I get up early and I go to the Huntington Medical Research Institute. We are here in Huntington Hospital. And Dr. Harrington and I, we go over cases together. So we've been collaborating for the last 5 years. I'm the chair of neurology, do you remember that? At the University of Southern California. And also the director of the Alzheimer Disease Research Center at USC. And the Alzheimer Greater Los Angeles, asked me to give an update on Alzheimer's, and I'm sure you'll have lots of questions for me. But during the presentation, I'm going to focus on the risk factors for cognitive impairment in Alzheimer's disease. I'm also a board member of the Alzheimer Greater Los Angeles. And you know all the Alzheimer Greater Los Angeles people in the back there. Our CEO is Heather. And Kathy is invited me today for this honor. Thank you. So, here's a graphic from the Framingham Study outside of Boston. The Framingham Study is very famous because the researchers wanted to know what are the risk factors for a heart attack. And their research started in the 1950s. And we've learned a lot from their study about risk factors for heart disease. But they followed people, they followed their children, the offspring study, and they widened their interest from heart disease to stroke and to dementia, and particularly Alzheimer's disease, which is the most common cause of dementia. Now there's a graph on the left for women, and there's a graph on the right for men. And this is showing the lifetime risk for women or men after age 65. So that's when you can sign up for Medicare. And it runs out to 100. Thank you. And the red here is the risk of a stroke for a woman, and it goes up with age. The risk of stroke doubles every 7 years, and our risk of mortality actually doubles every 7 years. This is the year of the dog, right? And Happy New Year, everyone. But the Chinese calendar goes every 12 years, but actually our biological calendar, our mortality risk doubles every 7 years. The risk for Alzheimer's and dementia is shown in blue, and the risk for dementia and Alzheimer's doubles every 5 years. As we get older, it's the time as things start to accumulate. Are you all depressed? So we're going to talk about what we can do to lower our risks. But the chance for a woman after age 65 of getting a stroke is about 1 in 5. Okay, so we look around the room, 1 in 5, and the risk for Alzheimer's is about 1 in 5. So these are very important topics after age 65. For men, the risk of stroke is higher earlier in life, before age 65, but it still is pretty high here. Okay, and for Alzheimer's, it's a little bit less. Probably, I say men get a little discount on Alzheimer's disease, but men have a higher risk of cardiovascular disease than women. Something gets all of us, as you know, one way or the other. Now, I'm going to divide my talk into 3 sections. First, we'll talk a little bit about the risk factors for Alzheimer's disease. And the most common risk factor is a gene called apolipoprotein E4. It's quite a mouthful, so the best way is to say it multiple times. Apolipoprotein E4. We call it ApoE4 for short. Okay? They're the most powerful genes for Alzheimer's, are fortunately rare. Have any of you seen the movie Still Alice? Okay, and she was a professor at age 50. The movie opens, and she's forgetful. When the dementia starts at before age 65, we call it a pre-senile. Senile meaning elderly. So this is before one is getting to what we call elderly. The dementia starts. We call it a pre-senile dementia or an early onset dementia. And there are families where there's early onset dementia, and there's 3 genes that are very powerful, and so powerful that the symptoms of dementia start in early age, pre-senile. Fortunately, those genes are rare. Now, if you're getting my drift, most of the risk for Alzheimer's is related to genes. But there's not just one gene, and there's not just 2 genes. There's over 20 different genes that can raise the risk for Alzheimer's disease. Okay, now we're also interested in vascular or metabolic or lipid risk factors for Alzheimer's disease. And I'm going to talk about that. High blood pressure, high cholesterol, high glucose, the 3 highs. They are certainly risk factors for heart disease and stroke, but we're interested in seeing if they might also be risk factors for Alzheimer's disease. And the last part of my talk focuses on some research studies. There's 2 kinds of, there's research studies that are observational, where we just follow people, and the one that Dr. Harrington is talking about, and we work together on it, is an observational study. We just come in and study. The other type is where we actually try a treatment. And the scientific method for these clinical trials of a promising new medication is to randomize people to receive a promising medication versus a placebo. So I'm going to talk a little bit about observational research and clinical trials for treatment studies. Now, the most common question I get is, Dr. Chu, what's the difference between Alzheimer's disease and dementia? Alzheimer's disease is the most common cause of dementia. What is dementia? Dementia means a decline in mental abilities, dementia. Out of mind, that's okay. D-mind, if you think of dementia, means a decline of mental abilities. There are other causes of that, depression, and something called delirium, where some of the other systems of the body that support the brain, I'm very neurologic centric, I'm very brain centric. So if there's kidney failure or liver failure or pulmonary failure, then we may experience a buildup of toxins, the kidneys aren't working, or the liver's not working, or if the lungs are not working, not a good oxygen, and the brain cells will falter, and that can cause a confusional state, which we call delirium. So not everything about change in mental abilities is a dementia. So dementia is a stage as well. It means it's a stage of severity where the decline affects one's everyday living abilities. Mild cognitive impairment means that there's a decline, but it's not so severe, so we call it mild, and people can usually compensate because it's mild. So with Alzheimer's disease, we have a dementia phase, and as we go earlier in time, there's a mild cognitive impairment stage, and then we have come to understand that there is a preclinical, pre-symptomatic stage where there are changes taking place physically in the brain, but the person is compensating fine and there's no sign of it. We can see those changes with some of our PET scans now, amyloid PET scans. So here again is a study, an observational study. It's called the atherosclerosis risk in community study, where they followed people for 25 years, beginning here in 1985, and then up to recently around 2012, 13. Follow people over time and see who gets dementia and what kinds of risk factors are associated with getting dementia. And the first most important one was just time, age. Every 5 years, the risk of dementia doubles. The second most common cause was this apolipoprotein E4 gene, ApoE4, and having one of those genes, one of the pair increases the risk of dementia twice. Diabetes, it increases the risk 1.8 times. High blood pressure, 1.4 times. And actually having limited education also increases the risk for dementia. So coming to seminars like this is a great educational activity. We're not really necessarily dividing our neurons, but we are certainly multiplying synapses, which are our connecting points. Those are very plastic and changing all the time as you exercise, physically or mentally or spiritually. The synapses are changing all the time. Alzheimer's is a German name. He was a German neurologist, psychiatrist, and in 1907 at a conference, he described a woman who was in her 50s, kind of like still Alice, pre-senile, who lost her mental abilities like her memory, her language. She also became paranoid, thought her husband was having an affair. Later, she became progressively demented, and after about 10 years, she passed away. And Alzheimer said, what's going on? So he got a permission to look at the brain at autopsy. And it was just fortunate that a colleague told him to try a stain, a silver stain, and he applied it on very thin sections of brain tissue from his patient. And he saw things that had never been described in the history of humankind before.